Good evening, everyone. Welcome back to a very, very special edition of the L&D Companion this evening. Before I introduce our amazing panelists today, what I wanted to do is just give a bit of context behind the event. So last year, I put together an initiative called Cheering the Cheerleaders of Radiography. Now, why did I put this event together? So over the years, having worked with many, many radiographers, some of them in this virtual room today, what was evident to me was that there were sparks of leadership that stood out amongst the crowd, let's say. And often what I had realised is much of this just goes as part of the course, you know, people just doing their job. And as a result of that, much of the amazing work just stayed very local, and just what we weren't getting was that behaviour, that positive behaviour that could spread amongst all of the profession. So what I wanted to do, and particularly during these very challenging and busy times that we have, was put together this initiative to celebrate these role models. So we set about asking for nominations, and I'm very, very pleased to say here in this virtual room we have our 5 nominations from the leadership group. I'm extremely honoured to be amongst this group, and I'm very, very excited for what we're going to discuss and speak about and disseminate today amongst the people that will be joining us. So thank you very, very much to everyone who's joining live and who's going to join us remotely. I hope you're going to enjoy this evening. We're going to get started. So before we do, what I'd like to do is also introduce to you another guest of ours who's joined us today. We've recently brought together a charity and education partnership with an organisation called SimPower. Now, Chris, before I bring you in, matey, Chris and I have known each other for a number of years now. We met actually at a cancer event, Chris, didn't we, in Westminster, possibly about 9 to 10 years ago. And the rest is, as they say, mate, is history. But, you know, during that time, we just gelled and you know, I'm so pleased and proud as punch to have you as our charity partner. And I wanted to give this opportunity for people to hear what SimPower do before we get started. So, Chris, over to you.
Thank you, Foddy. I'm Chris Lewis, CEO of SimPower, charity in the UK. We're the only one of our kind that do the work that we do. And so we connect people in poverty, bad health, etc. In the UK with the internet. So those that cannot afford it, either through poor health or, you know, just life circumstances, we help provide a phone or a bit of hardware, maybe laptops or whatever is required in the case. And we also give them 6 months completely free internet access. And it's a great irony. We're here tonight and I'm just thinking about those people that don't have internet access, and those are the people that we deal with, right? And here we are sitting with people all around the world, all around the country, all listening and sharing our expertise, right? But we're incredibly fortunate that we're actually able to do that. So the issue, as you're all aware, you're all health professionals, and I'm sure our guests are very much aware that now everything's online. And our wonderful NHS and government, in their wisdom and their magic app that's going to help everybody, but like 30% of the population can't even access it, right? So that puts a lot of people out. They can't get GP appointments. And the country is really, really struggling, particularly in healthcare. As Foddy says, I've known Foddy for about 9 or 10 years, and this charity came about because of my own cancer diagnosis. So a long time ago now, back in 2007, I was given 6 months to live. I had mantle cell lymphoma stage 4. And at that time, life wasn't looking good. And the guy who was looking after me said, "We don't get many cases like you." You know, there weren't many statistics for mantle cell at that time with stem cell transplants and stuff like that. So I've had a couple of stem cell transplants and various other stuff. I'm still a patient, but I'm in remission. But what I saw was I've spent a lot of time in hospital, either in the waiting room or in a bed, months on end. And what I saw even at that time was a problem for patients and staff, by the way, communicating. And there were a lot of patients there with those awful things that I want to throw out the window every time I see it, is those televisions that are stuck to the wall, that ask for a mortgage for you for just to stay in touch with your loved ones. Right? I want to throw those out the window. And people that were they had internet and they had mobile phones, but it was very, very costly for them to use it how they wanted to use it. And of course, being the NHS, Wi-Fi isn't a great, what's the word I'm looking for? Isn't a great issue as far as they're concerned. It's not a priority. And so most hospitals, most older hospitals particularly, you can't get any Wi-Fi reception anyway, even if you wanted to log on to the wonderful app that now exists. So this is a major, major problem. And I've been fortunate enough. I've done a lot of talks, as Foddy knows, around the globe about my cancer issues. But what's really come now to the fore is SimPow and its work, because without us now, there is nobody else. And I don't really say that in a proud way. I say that in a sad way, because everything is particularly technologically linked. And we, you know, the most that we want to say is that our healthcare is equal, right? But before we start, it isn't equal, because so many people can't even access it now, let alone the other issues that we know all about, the political issues, the postcode lottery and all that situation. But before we even start, people can't even access the system. So that's a problem that I was offered an opportunity to get involved in. I'm a business guy, so you know, I look at business opportunities, and that's why I think Foddy and I really hit it off, because Foddy's always looking at other opportunities and better ways of doing things, right? And that's me. That's exactly what I do, and I do that for a living. So I knew there is a simple way of helping the digital poverty world, but it's all stuck behind politics and big money, Microsoft's, Vodafone's, and all these characters. Apple are one of the worst, of course, that deliberately make their tech go out of date very quickly. And so a lot of people are stuck trying to keep up financially with that, which many people can't do. So what we've done is we've taken the devices that a lot of people can't use, and we recycle them and we put them out again to give a use to the people that can't actually connect. So, you know, we're totally unique. It's not it's a big problem, but it needn't be. I've wrote a post this week on LinkedIn about the economics of madmen, and the NHS and the UK government combined are incredibly guilty of such a waste of money. It's unbelievable, because we deal with a lot of people that are isolated physically and mentally. And you know, they get good service. People go around their house 3 days a week. Why? Because they haven't got a phone. Right now, our cost, quite simply, to help somebody like that is £50. We give them a phone, and we give them six months of free internet access. Now, that £50, I'm not saying it's going to solve their issues, because it's not going to solve their issues, but it's going to make them accessible to the service that needs to speak to them and the various services. So, you know, with that itself, it will pay for itself in an afternoon. But, you know, 3 visits a week to these people costs a fortune, with a lot of expertise not being where it should be, just going round there because they don't have any communication. So these people now, let's be fair, healthcare and poverty, we know, are completely linked. Okay, and I'm sure you'll know better than I do that a lot of people end up in hospital that don't need to be there, in A&E particularly, we're talking about, right? What they need is a bit of TLC, and they're worried they can't get an appointment with their doctor. They don't know what's going on, so they end up in A&E, right? And we do a lot of A&E work as well, when nurses just don't know where to turn, because the help that's being offered is actually online to the person who can't afford it, right? So there we go, round and round and round in a catch-22 situation. So I'm looking to create societal change. I'm not just here to give a few phones out here and there. We've been doing this work for 10 years. We have 6 volunteers. We don't have any employees whatsoever. And we cover the entire UK. So, it can be done without a great cost. All it needs is just proper thought and some joined up thinking, Foddy. I think you'll agree there with the NHS. It's not only the NHS. Unfortunately, most charities are run like governments. And I was speaking to one of the biggest poverty charities today, who has come to me almost begging for our help, because they have no digital policy whatsoever. I won't say the name for political reasons, but they're a massive charity. None of those charities, multi-million-pound charities, have no digital policy, right? Yeah. Imagine that today. The growth of technology, you know, with AI now, we sit and we laugh and we make funny photos and funny videos, but more seriously, you guys do incredible work with AI, right? And the people, we can talk about AI, but the people, they're not even on the ladder, the ones that haven't got devices, right? You know, we have a government system that gets them, wants them to log in, you know, DWP, right? You're asking people to log into a system they can't even access. If they don't log in on time, they get fined from the money they haven't got, right? So we've now got a system that sends all these people round and round in a circle, and unfortunately, they all end up in hospital in some way or another, right? Which costs the government, us, the taxpayer, and everybody else a fortune to deal with people that don't need to be there. A lot of mental health, right, is not mental health. It's because people can't pay their bills and they just don't know what to do, right? I'm not dissing mental health, by the way, because there is a lot of legitimate. But and the thing is, there are a lot of problems created for people by the fact that they can't connect.
No. And Chris,
so that's what we do. We're trying to improve the world.
Sorry, Chris, I didn't mean to jump in on you. I was just going to say sorry, I didn't mean to jump in on you. I was just going to say there's some, if you see the chat coming through as well, there's some messages there, and I've also shared the stuff that your website on there as well. And I mean, to be honest with you, Chris, I mean, you know, I think we probably would welcome an evening where we can chat through on SimPower as well, because I think some of the stuff that you've done, and there is an absolute reason why, you know, I wanted to partner with you as the charity partner, because of the amazing work you're doing, Chris. So, yeah, thank you so much, mate. And please, I look forward to working with you. Keep up the amazing work, sir.
Yeah, thank you. I just want to say we've been doing it 10 years. So it's our 10th year. We don't advertise. We don't advertise anywhere. You'll just find us by word of mouth, basically. Thank you. I'll shut up now. Thank you very much.
Not at all, Chris. Thank you so much, mate. And looking forward to seeing how we can develop our relationship as charity and education partner. Right. Thank you very much. And I know, Sian, you're on Q&A, so we're going to keep an eye on it. My orders moved. So, Kerry, you've now gone into my first. So what we're going to do now, everyone, is we're going to introduce you to the crew. And if you have any questions at any time, fire them into the chat, and Sian will keep an eye on them. So everyone's going to, all the panelists are going to introduce themselves. I can't wait. Kerry, over to you.
Thanks, Boddy. First up, always a good place to be. So hi, everyone. My name's Kerry Mills. I currently work for NHS England as the National Strategic Lead for Clinical Education Programmes. And the programme that I look after is cancer diagnostics, genomics and healthcare science. There's about 44 different professions in that. But more importantly, I'm a diagnostic radiographer of nearly 30 years. And I think for me, that identity is something that no matter which role I'm in, it's something I'm very proud of and I actually hold really quite dear to me. I've had quite a portfolio career, including 20 years clinical practice, working inside imaging, outside of imaging, in different levels of practice. I've worked 5 years in academia as a programme lead for a multidisciplinary master's programme before moving into more strategic level roles at a regional and now a national level. I don't know, Boddy, whether you wanted me to talk about why we were being radiographers or is that coming afterwards?
No, I want it now.
Okay, no problem. Just wasn't sure if I was going to go on to that. So yeah, I became a radiographer, I think, rather serendipitously. It wasn't something I ever set out to do. I have to be honest. I went for my interview at Cardiff University and I didn't even really know what a radiographer was. Blissfully unaware, but I think it wasn't too long before I really fell in love with the combination of the science, the technology, the patient care and the teamwork. And I think probably since that time I've been fully gripped, but I think it's the people, whether that's patients, your teammates, you're working with, it's all about the people for me. So yeah, I'm very, very fortunate that every single role I've had in, people have been very, very central to that. I think that's why I'm drawn to leadership actually, very much so, because that really is such an interactive role and it's all about people. So that's me. Thank you very much.
Definitely. Thank you so much, Kerry. Rachel, over to you.
Hi, I'm Rachel Nolan. I'm currently the Assistant Lead for North West Anglia NHS Foundation Trust. I'm also the current President-elect of the Society and College of Radiographers. I trained in the late 80s, so did a DCR and qualified in 1989. I've always worked at Peterborough throughout my career. I've been there for 36 years now. I absolutely love where I work. I did 3 years as a general radiographer, diagnostics, and then went into ultrasound, which I did for about over 20 years. Absolutely loved the patient interaction with ultrasound. Moved into a leadership role, ran the ultrasound department. And then I went into my current role about 15 years ago, helping to manage 7 sites and over 300 staff. I fell into radiography. It wasn't my first career choice. I was going to do hotel management and then changed my mind at the last minute and just happened to see an advert in the local paper for radiography at the Lincolnshire School of Radiography, which obviously is no more, but I understand the University of Lincoln is now starting a radiography degree, which is amazing. And I just absolutely love being a leader. I don't like the word manager. I won't use it in my job title. I've put my foot down about that because I feel we lead people. You manage things, and I gather, you manage departments. I get that, but I class myself as a leader, and I really enjoy sort of leading and mentoring staff into leadership roles. And that's me.
Amazing. Thank you so much, Rachel. Melanie, you're in my top bottom left-hand corner. Over to you.
Hi everyone, so my name is Melanie Clarkson and I'm a therapeutic radiographer. I started my career in the last century training on cobalt units and again fell into the career because I'm a failed physio. I decided snooker was better than revising for my A-levels. And therapeutic radiography at the time was my second choice, but definitely is not my second choice now. I worked clinically at South Tees for 14 years and during that time had secondment to the university and made the leap into academia 12 years ago. I now primarily work in advancing practice, so enhanced, advanced and consultant practice for therapeutic radiographers, but for diagnostic radiographers as well. And I have a senior lecturer now at Sheffield Hallam running an MSc and a PGC programme, and I have various other voluntary roles outside of that, working for the Association of Advanced Practice Educators, the International Group of Advanced Practice Educators, and Deputy Director for the Academy of Advanced Practice Research. So I've also been involved in curriculum design for both enhanced and advanced practice, so really looking at the education and training and bringing along academics and researchers in that space.
Wonderful. And flying the flag for therapy radiography as well, Melanie, which is great. Thank you so much. Carolyn?
Hi, everyone. I'm Carolyn Costigan. I am a diagnostic radiographer by background. I trained in the dark ages, even before Rachel, our president to be. I did graduate when I was 20. I like to say that because I've been doing radiography now for 40 years, which is, I think, amazing. I'm still in contact with the 10 people I started doing radiography with in Dublin in 1983. We're meeting this year, actually, for a reunion, one in Australia, but she'll be back. I wanted to do law, and I got a place to do law in college, but I deferred for a year because I just kind of heard about radiography, did a bit of work experience, and thought I might like it because I'm quite technical and I like people. I thought law might be a bit dry, so I have never regretted that. Love radiography. I worked in Dublin as a diagnostic radiographer for about 10 years. Started an MSc in MRI, the first one I think that they ran in Lancaster, and then moved to Nottingham, the home of MRI, to work as a MRI radiographer. Took the opportunity after my 3 children were born in 2 years to step back a bit from clinical practice and work in research. Purely, it interested me, but also it was a 9-to-5 job, which was useful at the time. Got a passion for MRI research and went on to do my PhD, which I finished just before the pandemic. And now I work as a clinical academic lead in a large trust in Nottingham, 20,000 staff. I'm a healthcare science lead. I do a bit of MRI radiography to keep my hand in, love being clinical as well. I am the research imaging representative for the ORD and the Research Delivery Network in the East Midlands as well, so representing the profession and imaging on the National Forum, which I really love. And like Rachel, I consider myself a leader. I've worked as a manager. I can manage people, manage department, but I think leadership is really, visibility and leadership is really important, and I really enjoy that role.
Wonderful. Thanks so much, Carolyn. And last but not least, of course, Elaine, over to you.
Hi, everyone, and thanks, Foddy, for inviting me to this. It's great to be with so many other eminent people. Like everybody else, I am a radiographer. I'm proud to be a radiographer. I can say I trained even before Carolyn and Rachel. So I started in the 70s. Before you even needed A-levels to actually start. I started with GCSEs, had no idea what I wanted to do when I was at school. Most of my friends were either going to office work or nursing or teaching. I just knew I didn't want to do that, despite the fact I worked at weekends in a care home for elderly and disabled people, which I loved, and I loved that interaction with the patients. So I spoke to a careers advisor who gave me some information about various types of work you could do in hospitals. So I wrote to some of the professional bodies. Not all of them replied, but the Society of Radiographers did, and they sent me some information. So I followed that up, and I was really interested in the fact that it wasn't just that social interaction with patients, there was the technical and scientific element as well. I did come to regret that when I started training, because I hadn't even done physics at school. It was really hard, but I did get through it. And in those days, you saw advertisements for students in the local papers, and I was equidistant between 2 local hospitals. So I applied to both of them, both of which accepted me, and I had to make a choice. Well, the choice came down to 2 things. The first was, which was the most convenient bus route? So despite the one I chose having 2 buses, it meant I didn't have to get up as early as the other one. So that was the other one thing. And the second thing was, the superintendent that interviewed me was so scary. I didn't dare ring her up and say I didn't want the place with her. So I accepted it. But It was great. It was a superb place. It was a small DGH and I learned so much there and I loved working in every aspect. But in those days, it literally was just X-ray. They were just bringing ultrasound in. We did do mammography, but it's nothing like mammography is today. After a few years, I left to bring up my children for a couple of years. And then out of the blue, I got a phone call from a friend to say the hospital she worked with, somebody had gone on extended leave, would have liked to go there for a 6-week temporary contract. So I said, oh, yeah, it's coming up to Christmas. I could do with a bit of extra money. So I started work there and it took them about 47 years to get rid of me after that. I loved it. And they were starting to introduce all the other modalities, which I got great experience working in CT and MR as they came online. Angiography, we had a neuro department, and even as a part-time radiographer, I was given the respect to go in and lead some of those services. So every bit of my career I've loved, and then I started to move into more responsible positions. And like everybody else, you can manage departments, but if you can try and find a way to lead people through, that's the best thing ever. So that's me.
Oh, that's amazing. Thanks, Elaine. And thank you, everyone. And look, there is an overarching theme around leadership. And this question does come along all the time, doesn't it, around the difference between leadership and management. And to all intents and purposes, you know, all organisations and hospitals are one of them, need both in some way, shape or form. But definitely when it comes to managing people, it's definitely done with a leadership mindset. And you're all here today because you've been nominated, and I'm so pleased that people went out of their way to give that recognition. And what I wanted to do, and it's quite a subjective one, this, but what I want to do is ask you all what it is that inspired you to go down the path you did in terms of leadership, and your thoughts around what a role model is. And I know this is really difficult, and I'm asking very humble, modest people in the room to a question like that. But actually, what I want to do is coax it out from this, because what we're trying to do is understand and tap into the minds of those cheerleaders that have been nominated, because somewhere along the line it was someone that inspired you, maybe, and it's something that, you know, is potentially ingrained in you. But genuinely, I want to get that question out. And before I ask the you guys as the panel there, what I want to ask the people in the chat is that if you have any questions, if there's anyone in particular, write the name of the person you have the question for. And if it's just a generic one, we'll ensure we'll ask everyone. So I'm going to go back in a reverse order. So Elaine, I want to ask you first, your view of you know, being viewed as a role model. I know we've spoken about this before, and it's, you know, I had to beg, steal and borrow to get you on this virtual room because of the way you are. But genuinely, I'm so pleased that you're here with us, because, you know, not only have you been inspiring to the person nominated, you've been inspiring to me as well. And I just want to get under the skin of you know, how you viewed it sort of through the years of leadership and being a role model.
Yeah, I find it very hard to be seen as a role model. It's just something that comes naturally. That even when I first started even as a student, helping other people, that just seemed a natural thing to do. It didn't seem forced, or I didn't see myself as a mentor. It just seemed that was the right thing to do. And I hope I've gone that way throughout my career. And sometimes I've looked at other people and thought, oh, I'd like to do it that way. Even down to clinical practice. I can remember I'd been qualified quite a number of years, and we had a student come in. She was just in her second year, and she produced the most brilliant images. I thought, whoa, I've got to come up to that standard, or, you know, even better. And it's looking at other people as well, and not only radiographers, other people within the department that might not be in the same role, health support workers, admin people, the way they go about things. And I think you can pick up tips and hints of how to do things by looking at at other people. And outside of my role as radiography, I'm a magistrate. And I can link that back there. I'm a presiding justice now, so I sit there in the chair most of the time. But what I love best is to sit on the wing and observe somebody else and pick up hints of how they can do it, how they can get people to come out of the shells and talk to them. And I think that's just... I hope it comes naturally. I do find it hard to be seen as a role model. But it has been great over the years when people have commented, oh, I can remember when you taught me to do X, Y, and Z. And I didn't remember, but it's stuck in their minds. And I'm sure other people here have got examples just like that.
Definitely. And the immediate thing that sticks out there is, obviously, other than the humility there, Elaine, is that, and for practical guidance reasons, is, you just something that you felt naturally was the right, doing the right thing, and that's what, what's driven you, and that's I'd say that's probably going to be an overwhelming theme of people from the group. But in terms of giving practical guidance to people, that's yeah.
I think good communication is a key thing, and that's not just talking to people. It's the communication ability to listen to what they're saying. I always try and listen twice and speak once. My grandmother used to say, you've got 2 ears, 1 mouth, use it in those proportions. And I sometimes found it, if you sat back, talk to people, did you say this? And then you can work out what you want to do. And that communication, also being visible to people so they're not frightened to come to you. And that helps you understand your team and how you're going to help them forward. Because let's face it, we've all gone through an awful lot of change in the many years we've been in the health service. Things can switch 180 degrees overnight, and we have to lead the people through that change and not frighten them, because it's frightening us sometimes as well.
Yeah, definitely. Do you know what, Elaine, and I'll bring Carolyn as well, but just to answer you on this one, I suspect, and I don't think I'm wrong on this one, that wherever we put you all in this virtual room, whether it was last week, 5 years ago, 10 years ago, 20 years, a role model is a role model. You work in the way that you work, and even though the system has changed and healthcare has changed dramatically over the last however many years, those behaviours and those acts and the nature of people, that's just how you are. And I remember when I first had my first manager when I was an apprentice, he was reaching actually the twilight of his career. But I looked up to him from day one, and I imagine whenever that person, whether it was 10 years earlier or 20 years, he would have been the same person inspiring people. And so that's just something I just wanted to share. So thank you for that, Elaine. Carolyn, before I bring you in, one of the things I wanted to also ask of you when you speak about this is how you attributed your transition from leadership from radiography circles into being a radiographer in circles that weren't necessarily, the radiographers in different healthcare spaces.
Thanks. I always say, people talk about role models. Nobody sets out to be a role model. I set out to be the best radiographer I could be. I'm curious, so I wanted to do a master's. I was really driven to do a PhD. For personal satisfaction, it wasn't a career. I had no idea where my career was going. I was working as a manager when I started my PhD. The new opportunities fell into my lap, but leadership is just being brave enough to apply for roles that aren't necessarily for you. I'm a clinical academic lead for healthcare science. I'm not a healthcare scientist, but the job really suited me. Applying for things that don't necessarily say they're for radiographers, but you feel you could do them as a radiographer, and going on to national committees or my RNI board at the trust. in your role, but saying, I'm a radiographer by background, and this is what I do now, and sort of being proud of your profession, but not afraid to step up and go for a more ambitious role. I think being clinically relevant as well is really important. I've always just done a little bit of radiography, keep my hand in, because I really enjoy it. It's usually the best part of my week today, going down to MRI for an hour or two to scan, working with students. Started off in the room with 2 people. There was 6 by the end of it because they're a really interesting case. And I just absolutely love that. That is just a really big part of what I do. I really like working with students. I think being a really good role model, and that's both being dressed appropriately for your role, introducing yourself to everybody in the room, checking everybody's level of knowledge, giving them opportunities for questions. This is your patients and the people you're working with. And I have the privilege of being able to do that because I've got time to do that. And I find it really interesting. I get asked to mentor people a lot, and I find that really flattering. I'm sure because people ask me nicely, but it's really nice when someone said, I heard you speak, or I met you at this conference, or I remember you when I was a student and I remember working with you. Would you be available to help me? Would you advise me on this? Would you be my mentor? And I think that's amazing. It's something I really enjoy. And so leadership is putting your head above the parapet, getting out of your comfort zone and doing your job well, and, saying you're a radiographer and this is what you do. That's what I think it is. And also, I'm not afraid to talk about my failures. The fellowships I applied for and I didn't get, things that went really badly for me. I'm very honest about that, because I think that it's encouraging to people to see that you picked yourself up and moved on after failure. Everything goes your way all the time. Not every job is given to you first time you apply for it. So articulating your failures, staying clinically relevant, applying for stuff that is slightly out of your comfort zone, and accepting rejection as well as success is really important. And yeah, communication. I'm very chatty, so communication is my forte. And I've had some fantastic role models along the way, and that you cannot deny. The radiologists who encourage you to advance your career, fellow radiographers who are really, really supportive. And my family have always been amazing. When I did my PhD, my kids were just starting university. Everybody was studying at the same time. It was a really good household for that. It was really encouraging. So yeah, bringing everybody along with you is really important.
I think that's a really interesting point. And Carolyn, I had the honour of interviewing you for the Crossroads podcast, and I hope you don't mind, but one of the things that stood out for me in that interview was when you said to me about excuse me, your open door policy for people who were inquisitive and wanted to ask questions, but and actually how much it was around no matter what level they were. And actually over the years, sort of that for me is something which I think I've seen so much in the radiography profession, how much people are willing to help someone who reaches out. But that really stood out for me when you said that to me. And what was interesting also, as you mentioned about, there was some people maybe from other walks of professions that, will constantly ask questions and maybe not answer, when they have the answers because they may be being a bit lazy. But you know what? I think in the first instance, what really come out to me was that, in that inquisitive space, that you always had your door open. So yeah, that's certainly something I think is was lovely for you to have said, and I think that is part of that that role, I guess, of being a leader. So thank you. But Melanie, over to you.
It's really true. I can see. I was just going to say before I go on, I can see Val asking a question about formal leadership education. I always scoff when people send me on leadership courses and I go on them under duress and come back going, that was amazing. I've learned so much. So yeah, I think it's really important. Leadership education is really important, even though it can be difficult. I think it's really, really important.
Do you know what? Actually, just before I do bring you in, Melanie, just on that note, actually, what's interesting for me as I've embarked on the L&D Companion is that I think there are lots of leadership courses out there, but what's interesting for me is about how the people that go on them connect with it. And, I'm not saying it always has to be specific to radiography, but actually if the people doing the courses are even once or twice removed from the day-to-day grind, you may not get the impact from the attendees that you need. It needs to be real. It needs to be authentic. It needs to be, you need to connect with your attendees. So I just wanted to mention that point as well, Carolyn. But thank you for that, Melanie. So over to you.
It's funny because I don't see myself as a leader. I would say that I've probably accidentally fallen into whatever position this looks like. What I would say is I've just taken every opportunity that's come along. Some of my very close friends do try to instigate that I have a flow chart, because I'm not very good at saying no. And sometimes potentially I may have taken, excuse me, too many opportunities on at the same time. But for those people who know me well enough, know that I often talk about careers as growth and not just being promoted into the next band or, those types of things. There's so much that you can gain in terms of skill development and opportunities from the smallest things, and that often snowballs into something else. And I think that's how I ended up where I am now, because I just said yes to the opportunities that came along. Yes to working on a national curriculum development. Yes to saying that I would continue to lead that when somebody left. So yes, it's quite ironic that I sit on a panel full of leaders when I don't really consider myself to be a leader, and I've never done any leadership training. But I think for me, I too, like Elaine, when I worked with undergraduate students, seeing them flourish and seeing them come back, and it would be me that they would ring to say that they'd been promoted before they rang their mums, and those types of things. My main aim is that I just want radiographers to reach their full potential, whatever that might look like for them. Be it that they want to be the best band 5 in the world, be it that they want to be the best academic, the best researcher, they want to be a consultant practitioner, whatever that looks like, it's about supporting those. And like Carolyn, I kind of have an open door policy that if somebody drops me an email and wants a chat, that's fine, and I'll can have a chat with them and point them in the right direction. But I think I've probably learned from some of the best role models who have taught me to bring people along with me. This is not a solo journey. You bring people along with you and upskill them, and they upskill you without without them even realizing you learn something from them. So I guess for me, it's just continued growth, radiographers reaching their full potential and just sharing what you have to offer. I know that Lydia's just put in the chat about the barriers of moving into academia. I guess, things have changed since I did my jump into academia. There was secondment opportunities, and I think we're in a very different space now. But I would reach out to your local universities, but also, because we do a lot of distance learning, to universities that you feel have got the reputation that meets your values, because then you can share, what is your expertise, what it is that you want to teach, because universities don't know who's out there and who's willing to teach. So you go to them and tell them what you've got to offer. And it might be the first couple of sessions are a bit of a I'll do that for free type of thing to build up your confidence and development, do the practice educator training, get to understand how curriculum and assessment works, and then dip your toe that way to see if it is for you. And if you do want to make that big leap, it is difficult having 2 jobs at the same time. I did that for a number of years because it's like having 2 full-time jobs. But at least then you get to know which one you want to do.
Yeah. No, Melanie, a couple of things come out from that. Firstly, thank you for saying yes to this as well. and the other thing, it's never a coincidence when people ask you to do good. I mean, people maybe ask you to do things and you can maybe take on too much. And I suppose over time, your instincts will tell you, you know, whether you should or shouldn't take those things on and stuff. But people won't ask you to do things unless they don't think, you know, unless they think you're capable. So there is, you know, there is something in that, in you know, when you do make yourself available for these things as well, that you know, that's how opportunities come your way. So and the other thing I just want to add to that before Rachel, I'll bring you in, is that I think over the years, when you're kind of the character and the way that you are, Melanie, and how you just described there, is you can overburden yourself. And this is where really the feeling of being valued, the feeling of trying to know that, no, yes, it's not always about the recognition, but just every now and then to know that there is that value being, you know, shown back, I think is really important. And that's where I think the leaders, you know, can just keep you going on a bad day, on a difficult day, when you've taken on just that little bit too much, and you know it as well. And just someone sort of just saying to you, you're doing a great job, just makes a big difference. So thank you for that. And Rachel?
I think I sort of fell into leadership, really. I was, my 3 years as a diagnostic radiographer on the shop floor, I was the one always fighting against management. And myself and a colleague, we got to the point where we didn't like the way things were being run. And so I just remember our superintendent at the time, it was to do with an on-call system. He just came in, gave us all the paperwork and said, okay, you two think you can do a better job with this, have a crack at it. So it's like, okay, and we did. And then when I went into ultrasound again, I ended up being the deputy in ultrasound, and then the ultrasound lead again. Fell into that. It wasn't necessarily a conscious thing, but I enjoyed, within ultrasound, taking us to one of the first ever fully sonographer-led services. Worked really hard with the radiologist, and loads of people probably heard of Dr. Roger Moshi. We wouldn't be where we are today as an ultrasound department without him. And so I moved into my current leadership role about 15 years ago. That was a conscious decision. I loved ultrasound, found it really difficult to let go. I was clinging on by my fingertips because I'd set up the ultrasound contrast service, but I couldn't do the two things together. But I think I have done some formal courses, but for me, you learn an awful lot on the shop floor. That's how I learn things. I'm not an academic. We had a conversation offline to start with, and I was saying, you know, my history, geography, and home economics A levels didn't particularly stand me in good stead for doing my DCR. But I think that has enabled me to have a different ear to radiographers that are struggling academically, if they've chosen to do a postgraduate course, or our students, etc. I think that gives me a different perspective on it. I also have an open door policy. I'm also in a shared office. I'm a massive extrovert, and I do apologise for that. But I can't be on my own. It's just a weird thing. I'd rather be lots of people. But I think for me in leadership, I've mentored quite a few of my team into leadership positions. In fact, one of my operational superintendents, principal operational radiographer, she was a band 6. She's now an AA. I mentored her through to the position she's in today. And I think when I retire in a few years, I think she'll be champing at the bit to get my job, which is fine. And I'm a big one for looking at plans for when people are going to retire. You know, we've got to have succession planning. But I think one of the big things for leadership for me, as I say, I'm not particularly academic, but I've helped create an awful lot of enhanced, advanced and consultant practice where I work. You know, I'm a big one for, if people want to do something, I want to give them the tools to be able to do that. And I think, you know, when you look at our structure on Model Hospital, we're very, very top heavy in our trust with sort of an enhanced, advanced and consultant practice compared to, say, band 5 and 6 radiographers. And we actually have really, really low turnover. If you look at our turnover stats, it's primarily people moving up rather than moving off. which I take that as a massive compliment. And I have people ring me up wanting to come and work for us because, and I will never turn anybody away for a conversation that they want to come and develop their careers with us. So I think for me as the leader, I wouldn't expect anybody to do anything I wouldn't do myself. I actually went back to the floor and did some radiography shifts, bearing in mind the last time I took an x-ray, it was on film with chemicals. I did have quite a lot of my junior staff coming in going, oh my God, it's true, you've got a uniform on. I'm like, yes, I am a radiographer. I do know what I'm doing, honestly. But that was a superintendent I had when I first qualified. He would not ask anybody to do anything he wouldn't do himself. And I think my first 2 weeks as newly qualified, we had to do every job in the department, from film filing to doing sort of putting reports in film packets and things like that. And I'm still an advocate for that now. Although I don't work clinically, I know every day what's happening on the shop floor. And I'm a big advocate for flexible working. I've been working with Leandra, the SOR, on the flex working campaign. And I think for me, it's being accountable for the staff, but also allowing them to develop. And everybody wants work-life balance these days. And I think it's really important to allow that. And I'm always happy to challenge our execs and directors. I think they dread it when they see me come in, but I think I've got to that point in my career where actually they should be challenged. As an exec, you can't expect people to always be yes people, but I think they do sometimes see me come in and think, oh my God, here she comes again. Next body.
Well, do you know what, Rachel? I mean, I hope you don't mind me saying this, but I mean, the view, how I would describe the conversations we've had over the years and the things that you've worked on is ahead of the curve leadership. And I'll tell you for why. And I do want to ask you one question. And interestingly, I will bring you and Kerry, who's working on this PhD at the moment, which I'll definitely want you to share on leadership. But Rachel, one of the things I remember when I set up RIG reporting in 2013-14, you and I had a conversation, and we spoke about back then when you were implementing your hot reporting service with your radiographers and how proud you were about your advanced practitioners and your service. And do you know what else you said to me? And I don't know if you remember this or whether it will resonate. And I promise you it's nothing bad. But basically you said about the fact that sometimes you would need to take that rap for overspending in certain things. And that always stuck with me because, it does take a certain type of leadership to push back, because now we're obviously in a situation where, finances are scrutinized. And if you haven't got necessarily that position point where you're gonna argue back, you might be overhauled by the penny pinchers. So very, very quickly, if you don't mind, if you just want to sort of mention about that sort of aspect of, because I think in this day and age, being a radiology manager or leader, I think that, that's one of the biggest challenges people are going to face around the business plan, the red tape, and actually it's not necessarily I'm not necessarily trying to celebrate overspending, but the reality of it is, one thing potentially compensates the other, right?
Yeah. I think my mantra's always been, it's better to ask for forgiveness than ask permission and be denied. That's what I've always said. It's not quite as easy to do that now, but we're always looking at ways to use the budget we've got more effectively. So, for example, at the minute, I'm looking at the spend we've got going out to one of our external providers for head reporting. And I'm working out how many radiographers reporting heads I could get for that same amount of money to release radiologists to do other stuff. So I think it's always about being creative with budgets and backing it up with the data that you've got. So converting what posts you've got into what you need. And I think, we've always pushed the boundaries of that. I mean, I do appreciate, and, even I'm sort of getting pushed back at the minute. I've done something that I probably shouldn't have, but I'm now having to justify it. But for my mind, it's for patient benefit. Everything is to benefit the patient. So I'm now being questioned why I allowed somebody to do their nuclear medicine reporting. Did I promise them something at the beginning of it? Well, maybe I did, but hey ho, it's only going to cost £1,500 extra a year because she's on the top of 6, she's going to 7, and that's my justification for it. This benefits the patients, it benefits the cancer pathway. But as I say, I think that's just me. I'm happy to be challenged on it because I've usually got an answer of some description for them. So.
Oh no, I appreciate you sharing that, Rachel, and I suspect particularly the challenges obviously that we face in our current healthcare system. And interestingly, Kerry, as I bring you in, I think it's so apt that you are working on a PhD for within leadership at the moment, and I'd love for you to describe what got you to the point you are now, where you decided, you know what, this is the PhD I'm going to do.
Sure, no problem. I'll just quickly go back to some of the role modelling, because we've had some really interesting thoughts here. And I think the role modelling for me became really apparent. Everything I've tried to do as a leader is something that has happened to me in my journey that I've tried to make better for other people to experience. So I think it was Carolyn who mentioned curiosity. And I've always been a curious person. I've always tried to strive for other ways to do things, or can we do something better? So I think I may be labelled a disruptor at work sometimes because, during my career, because I do question things. And I think that's a really important part of moving forward. And I think that's landed me in roles or doing projects or things that nobody's done before. So therefore, actually, there isn't a rule book to it or anything to tell you how to do it. So I've looked to role models to support me in my own development. And what I found in terms of the role modelling, it's not just good role models I found some really bad role models as well. And that's kind of how really, really important to kind of recognise that as well, is that we really need to be, how important it is that we model behaviours rather than just directing them. Because people watch what leaders do. They don't just listen to what they say, they actually watch what they do. And, we've talked about being visible, but it's also about being accessible, being consistent, integrity, all of these really important words that are such important values. And it's really important, I think, as role models that we actually live, through those own values and that sort of thing. So again, role modelling, really, really important to me personally. But yeah, my doctorate that I'm in at the moment, that I'm just working on, just doing data collection, is looking at self-perceptions of leadership amongst radiology service managers. I think role modelling is featured massively in it actually already in the data, which is so fantastic. And I think in a world where we're shaped so much by performance, it's all about performance. We as radiographers, of course, it's surrounded by the patient, but that's not what we're hearing at the moment. We hear from the government, we hear from everything that it's all around performance. And actually what we understand is the people who are performing, the people who are working, actually if they have some more self-belief, if they have confidence in what they're doing, if they feel supported, actually everybody performs better because we naturally strive to do more and we feel more secure and valued in the space that we're working in. So again, it goes back to that role modelling. But I think my frustration came in that radiology service managers hold such important integral parts in, they're one of the biggest cogs in the whole of our systems. And actually the lack of support, the lack of recognition, the lack of training opportunities to actually help them, because making decisions is a really brave thing to have to do. And they hold a huge amount of responsibility and accountability for their staff, for their services, for the patients that come through them. And I think what we often see is, we've talked about the difference between leadership and management today. Actually, they're managers, they manage things, but actually they are leaders. But what the research already is starting to tell me is that they don't see themselves as leaders. They don't feel they can really step into that role. And I think it's really important that we get the evidence behind, because again, there was no research around radiology service managers. There was a massive paucity within the literature, which is why I thought, I want to do something for this group of people that not only stretches me as a researcher and I learn all of the skills as well, but actually it's going to be touching a community of people who I have a lot of interaction with, and try and persuade them to be making decisions around their workforce planning, their education and training, taking on training grants. And hopefully if we can kind of support our next generation to think as leaders, hopefully that whole system transformation will start to take place rather than just more transactional flowchart types of moves. So sorry, I get quite enthusiastic when I start talking about my research because I'm really embedded in it. But hopefully it's useful to this conversation.
Definitely, Kerry, it is. And you know what's interesting about what you mentioned about the good role modeling and poor, good role models and poor role models. Something that I was told very early in my career, and I actually didn't appreciate it as much as the time as I perhaps do now, is someone that actually told me about Machiavellian leadership. And there is something about, you can still learn of poor leadership. What you don't want to do is let it knock you to the stage where you fall in line with what they're doing. You use it as your excuse me, your example of what not to do. And I've seen a lot of that in my career. And I think if you get to the stage where you realise what you're seeing, you can actually use it for good, right? I mean, when you see things like, the problem sometimes comes, and again, there was a book I read once around, it was called Rich Dad Poor Dad, and interestingly, the book said, if you don't like something, make a choice, do something about it. Don't sit there and just let yourself just accept what's happening. So I think what you say there, Kerry, and I can't wait to see some of the work that's going to come out from your PhD on this, because it really will help radiographers. And actually, this is a really difficult thing for us all to accept as a concept. But in the grand hierarchy of a hospital, radiology management sits in middle management. That is one of the most toughest places to be in any organisation. So any support we can provide to radiology managers at this time is going to be just invaluable. So thank you very, very much. Thanks, everyone. We've got some questions, and my Q&A has had to disappear because she's got an injury, but she's okay, she tells me. So sorry, Sian, that you've had to jump off. But I'm going to go back to Martin's question, and I don't know where to push this question, so I'm just going to ask it and see who wants to answer the question. But Martin asks, would the panel say that starting out along a deliberate leadership route, or was it more about becoming an accidental leader? Who wants to take that one first? Rachel, you've done the very process thing and put your hand up.
I love a process. I would say I'm definitely an accidental leader. I was just thinking back to my very junior radiographer days, and I sort of was moved into a more leadership role. Radiology service manager at the time, he said to me, myself and one of the other, we were basic grade radiographers back in the day, that he really didn't know what to do with us because we were so questioning all the time that actually leadership was probably the way to go. And sometimes when some of my more junior staff are, I love to be challenged. I love to be challenged by staff. I mean, I see that as part of my role. And I do always say to them, I was poacher, become gamekeeper. So, I've been there, done that, got the T-shirt and, but yeah, I would say mine was accidental leadership. But the most recent leadership role was definitely a decision I took because I wanted to do more for the wider remit of staff and more for patients in general outside ultrasound, sort of a broader remit. And that was part of the reason for doing my work with the SOR as well, just to do more of the same.
Yeah, thanks, Rachel. Anyone else want to take that question on? Where are we? Doctor raised their hand. Who's doctor?
Is that me?
Carolyn.
I think most radiographers fall into leadership. A lot of people say they don't want to be managers because they consider it a lot of hassle, which it is, and hate managing sick leave and budgets and things like that. And leadership is slightly different, but I think that you can fall into leadership, but if you don't enjoy it, you shouldn't be doing it. And that's really true. I fell into it, but I really, really enjoy it. And I think that's really obviously what kind of gets you up in the morning, doesn't it? And the positive feedback that you get and the reinforcement and that is really important to keep you motivated, because being a leader, sometimes you make unpopular decisions like a manager, and you have to be able to stand by that. And I think that's you're sticking your head up, as I said, but you have to stick by what you do. But yeah, as radiographers, you make at some stage the transition, like Rachel, into deciding you want to go for that job that makes you a leader. The first steps are usually sort of accidental, and again, because you speak up, or like curious or annoying or whatever you'd like to put it, but you're the person who puts their hand up and said, can we not do this, or why don't we do that, or can we try this? And suddenly you're a leader.
Hugely important, and it's a huge responsibility, isn't it? That's the thing. That's what maybe sometimes we don't realise when you go into leadership. It is a huge responsibility, but you then realise it thereafter. Elaine, I'm going to ask you the same question as well.
Yes, I definitely fell into leadership. I had no ambitions at all to be a leader. I just wanted to be a good radiographer. I did do some specific management leadership roles that I'd applied for. So I managed moving a smaller hospital into the main hospital. I applied for that because I wanted to do it. I moved into the PACS management role and was the PACS implementation lead for the first Greater Manchester PACS thing. I wanted to do that. After that, I seemed quite happy to just sit back. But other members of staff were pushing me. I'm not sure. There was a role that came up as deputy business manager. I'm not sure whether they thought I was the least worst possibility, but they certainly pushed me into that. But I did enjoy it. I just love being with people and being able to make a difference. And I think that's what leadership is. And, I took all opportunities to do different things. I got involved with the Northwest Regional Committee for the Society. I did an MA in developing professional practice, which I found really good because it wasn't just limited to healthcare. We even had people from Northern Rail and places like that and industry, which was great and gave me different aspects to do it. And then I did some work with NHSC on data collections. And I think that's how I've ended up in my latest role, which is the Girth Radiology Advisor, which I love.
Yeah. Do you know what? I have to say, Elaine, of the, with the exception maybe of the acronym, the situation that the work that Girth do is just incredible. And I have to say, over the years, and for those, I'm sure most of the people know in the virtual room, but for those that don't, it's getting it right first time. It really is the ethos and the work behind it. And what, Elaine, with that in mind, with the Girth role in mind, the idea of sharing this best practice, how have you seen that sort of accepted around different places that you've been to?
Mixed. I have to say it is very mixed. On the first round, we went into each of the individual hospitals, which you got very different opinions as you went in, but nobody said no to us. There was very few dissenters because we went in with a different mindset to people like the CQC going in. And in those rounds, we had a walk round, we spoke to the staff and we said to them, what are your issues? What do you want us to bring up with your execs? We can't solve everything, but at least we can put it on their radar. So that was good. We've recently done the network visits, and again, mixed visits. Some networks are forging ahead and others are slightly behind the curve. But in every single one, we found there are areas of good practice, even if it's just small areas that they're working as a network together, whether that's doing a joint policy for something or the CT superintendents getting together and sorting out protocols. So all those are in our report that people can click on and go to those people for some advice.
Yeah. No, I appreciate you sharing that, Elaine, and also the mixed, obviously, experiences. And I think that what I often say about careers in radiography, there are pockets of brilliant examples of practice everywhere across the country, and some of it is, there's no reason or rhyme to some of it, but other than the fact that actually, if you do scratch under the surface, there are leaders just like yourselves behind pushing it. That I think is a consistent theme, and you know, when we knock protectionism and resistance, and it walks in all different parts of the profession. The irony is, some of it comes from good, a good place, and that's the bizarre paradox of it. People think that by resisting something, certainly like advanced practice, for example, they may be coming from a good place, but often what you need to be able to do, like what GERF does, is go out and demonstrate what's going on so people can see it. Rachel, I don't know why I had to shout when I say that. It's almost like I'm...
That's fine. I think following on from what Elaine was saying, I mean, I remember going to one of the first ever talks about GERFT, and Kath Halliday actually used to do a session at Peterborough every week with our paediatric patients. But I think for me, leadership and what seems to have moved on and is much better now is people are more happy to share. Whereas when I started in radiography, if somebody asked for something from another hospital, we're not sharing, we don't want to share. Whereas now, I mean, I've sent out so many copies of my job descriptions to various places all over the country, because I've been quite lucky. We've managed to get our radiographers banded what I think is accordingly, because don't even get me started on gender for change and bandings, because you'll never stop me for the rest of the evening. But I think good practice and best practice, we do share more now than we used to. And I think, to me, that's a sign of a good leader, is the fact I'm happy if somebody says, well, actually, I've been to so-and-so and they're doing it this way. Can we have a look at it? Well, yes, if it's best practice and they're doing it better than we are. But whereas I think years ago, it was a very closed shop. People didn't want to share best practice. And obviously with QSI and GERFT, etc., I think things have moved on, and in that respect, things have moved on for the better, definitely. So that we're all sort of doing things at better quality. And I think for me, that's why I'm happy to challenge our execs, because they'll say, oh, well, you've got some new software, which means you can do more patients. Well, no, actually, shouldn't we use that extra time for giving our patients more time with us, more of a conversation, not just a production line. And I think that with the way technology's moved and AI is great, but I think we can't lose that interaction we have with patients just because we're making things quicker.
Yeah, absolutely. And there's a lot in there, Rachel, certainly that sort of final point you make around critical thinking. That thing, just to challenge, just that little bit, just rather than to accept and to follow. So no, I think that's I think it's a really, really, really valuable point as well, and practical guidance. And Melanie, if I can bring you in for a moment, one of the things I wanted to ask in you answering that particular question is also your experience about working across both areas of radiography, so from therapy and diagnostic as well. And part of what I want to do with the L&D companion is to show how strong we are as a unit. And one statistic just that I really quickly want to share is that, and I was told this by Janice St John Matthews, who we spoke about, who sat in the Chief Allied Health Professions office for a few years. She said to me that from a band 8A to C, we represent, as in radiographers, 5% of that group. But however, we are the fourth largest AHP job family collectively. So I just wanted to just share that thought, because I think what would be great in years to come, and all the work, Kerry, that you're doing on the leadership front and stuff, is that we can try and tip that balance a bit more for radiographers. So Melanie, just your thoughts on that, as well as obviously the question around accidental leadership?
I think it probably links to my accidental leadership. I've put a message in the chat in that I think sometimes it's hard to find those opportunities in the department because, everything is so stringently accounted for, and it can feel really frustrating. So clinically, I was a superintendent, and at least had some leadership skills in terms of the operational leadership of running a department and things like that. But I don't think that there's sometimes opportunities for your band fives and your band sixes. From a college perspective, the ECF brings in the 4 pillars. How we meet in the 4 pillars? Are we developing? We often talk about enhanced and advanced and consultant practice. We still need academics. We still need researchers. We still need radiographers to move into a leadership space, because whether you're diagnostic, therapeutic, sonography, mammography, whatever specialism you are as a radiographer, we have a unique lens at which we look at things. And to have a radiographer as part of your team, they will innovate your services differently from the viewpoint that they have. And sometimes it is really difficult to get that shoe in, and sometimes you have to look externally to gain some of those leadership opportunities. So for us, we've got the Advance in Practice special interest group within the college. That doesn't belong to any one of us as facilitators. The aim of that is we will step away. We've invited new facilitators to come in, gain some leadership skills of running a special interest group. Once you've got up and running, mentor the next one. You step away and you pass the baton continually, so that those people have had an element of leadership experience or exposure of working with things that are maybe slightly different to what happens in clinical practice, and getting a different perspective of what happens as well. So I think it is challenging. I think, like Rachel, I have a bit of a bee in my bonnet about Agenda for Change. Our job profiles are 20 years out of date. So to actually try to get radiographers to fit the job profiles, to get the band in, there needs to be a huge shake-up for that to happen. And quite often, I think we end up doing the role before we get the role, and the pay kind of comes afterwards.
Yeah. And Melanie, do you think what could we do better, do you think, from a leadership perspective, excuse me, in terms of working together from a diagnostic and therapeutic group?
I think just that collaboration, and just, we are registered as radiographers. We're not registered separately. And, yes, the activity and specialism that we work in might be different, but there are joint skills that we have that we can share and benefit from each other. The SIG is for every profession. And in fact, the majority, other than my shoe, peers working in a radiotherapy group with therapeutic radiographers, the majority of my work is with diagnostic radiographers, nurses, physiotherapists, a complete mix, because it's the opportunity to learn from other people.
Yeah.
And to link together. And I think, that's where we need to be. We're not a separate entity. We're collective together.
Definitely. Thanks, Melanie. And you mentioned about accountability, and Kerry introduced me to a terminology that I'd heard before, but never quite understood it in the way of how we could introduce it into radiography, Kerry, which was self-efficacy. How do we bring self-efficacy into radiographers? Because that's where those opportunities that you talk about there, Melanie, is around, how people looking outward for opportunities instead of inward. So, Kerry, what tell me, when we were talking about self-efficacy, what was we thinking about when we spoke about that?
I think it was about career development opportunities. We're talking about mentoring and coaching, and I'm a very big advocate that actually we should be developing our workforce to open their own doors and not wait for them to be open. And we should do that right from the very beginning. And actually, as someone was talking, quite a few years ago, when I was working in academia, I had a multidisciplinary cohort, and we were doing almost like a tabletop world cafe type exercise where there was a task on the table, and they would come in as a group and come and attack this task by writing on the table and working through the task. And we had physios, paramedics, pharmacists, radiographers, occupational therapists, a whole host of disciplines. And I can guarantee, I won't mention things, but I can guarantee you'll know who was the first up, who took the automatic leadership role, who was the person scurrying around at the back, waiting, like trying to make sure everybody was at the table, and who waited to be asked to the table, and radiographers were not the first up to the table. And that really that was quite a big reflection on me, actually, is how do we create space and confidence for others to step forward into the leadership space? And I think our responsibility as leaders very much is to produce leaders that are better than us. Bad leadership is keeping people down below in a very hierarchical way. Good leadership is about promoting people so that they excel and they move, forwards. And they move up, and that they, fulfill all of the brilliant potential that so many of our workforce has. So self-efficacy to me is about instilling that confidence and that desire to grow, as much as some people might want to grow, and that's absolutely fine. But it is about that self-fulfillment, and just not waiting to be asked. I just think we need to kind of just be able to support people to make most of the opportunities they want to do. And sometimes that is around that mentoring and coaching. And actively listening. If we think about it, I talk about it a lot. When do we actively listen to people? We listen, but we don't actively listen. And actually, if we don't actively listen, how can we then respond? By being able to support them in their decision making, asking those challenging, uncomfortable questions, checking in with their self-belief of what their own narrative is that they're telling themselves. So it's about being, making sure you are making the most of the opportunities available to you, and if they're not available, seeking them out. So I think there's some real common themes kind of coming across in what we're talking about here.
Definitely. And from the research that you did, Kerry, I mean, is it quite a consistent theme about, I mean, is there anything that coaxed out from that work around accidental leadership and falling into it? And because I think I once had someone say to me that she was a radiographer. Her husband works in a completely different field, but she became a manager. And she said to me, she went home and her husband laughed at her and said, nowhere else that he's aware of could you become a manager without some formal, training. She just went into it. Now, I happen to know this particular person will be an amazing accidental leader, and she will be a role model for others. But isn't that was just an interesting thought, Kerry, that come through. So it's just interesting to see what your research might.
I mean, like I said, it's just in the primary phase of data collection, and again, what's coming out is that, again, I want to be a radiology service manager in my career has never really came from any student radiographer. A lot of the people who've done the data collection or, done the first survey, completed the first survey, are saying, no, I just fell into this. I just happened to be maybe in the right time at the right place. When I was asked, I didn't strive to be a radiology service manager. But, there's three different types of kind of self-perceptions I'm looking at, in that their belief in themselves to act as a leader. It's also around how they regulate themselves, or how they feel, how well they regulate themselves in critical decision making in terms of leadership. But it's also the confidence they have in other people, in how they see themselves as leaders. So it's kind of quite a complex self-perception kind of theory that I'm looking at in terms of that. And it's really interesting, actually. It's I don't want to give too much away at the moment, because like I said, I'm literally just doing a little bit of the first data analysis as we move forward. But it's I'm sure there's going to be some really key findings coming out that will be able to fill the gap as to where we may be, needing to support our managers more, and other leaders as well, in how we really get people to fulfill that leadership role.
Definitely. No, I really, really appreciate that. Your thoughts on that, Kerry. Carolyn?
Kerry, I just really love that expression, empowering people to open their own doors. I think if I take nothing else away from today, it's exactly what we should be doing. Not relying on anybody else to do it for us, but empowering people to open their own doors.
Definitely. And Carolyn, just on that note, to all intents and purposes now, day to day, other than the day that you do in MRI, you're working with other professions, right? Is there many people doing what you're doing as radiographers, like countrywide as well as, locally?
So Monday, I was down at the National Imaging Forum, Research Imaging Forum, and that's a great group because mainly radiologists, a couple of physicists and a couple of radiographers, but everybody's got an equal voice at the table. It just depends on your region, what you are. And in fact, when I saw this being advertised, this particular post, part-time post, I showed it to one of the radiologists I work with who I thought would be perfect for it. And he's the one who said, well, Carolyn, why don't you apply for it? And it's getting someone to think, yeah, I could. And really weirdly, I was appointed without, very straightforward, did the interview from Australia on my holidays, was really committed in the middle of the night that I really wanted to do it. What's been really tricky is persuading my trust that they can pay me as it's costed as medical consultants, the PA. They said, well, but you're a radiographer, we can't pay you that. So yeah, they think it's too much, so they couldn't figure out how to pay it to me. And that's just embarrassing, isn't it? And a couple of colleagues have just said they haven't, they just can't get paid. It's outside the agenda for change, so what do we pay you?
Oh, wow. Oh, wow.
So you haven't got up.
Isn't that interesting?
Yeah.
Again, AFC doing its thing.
Yeah.
I think it's wonderful. Carolyn, do you mind sharing in the chat the organisation that you mentioned there, the Research and Imaging Group, just so people are aware of it as well?
Oh, so it's the yeah. I will. Yeah, I can't remember what it's called. It's the RRDN. That used to be called the CRN. So the Regional Research Delivery Networks, and it's the imaging specialty leads from all of those. So it's kind of influencing national policy and improving research delivery in your region.
Brilliant.
So there's leads in the East Midlands. All of the leads, except for imaging and maternity, or professors or consultants. So there's me as a radiographer for imaging, and there's a midwife for maternity, and everybody else is a medical consultant. So it's really nice to and just be treated equally at the table with everybody else and speak up for your region.
Brilliant. No, that's amazing, Carolyn, the work that you're doing with that. We are, blimey, we're almost out of time. But do you know what? Before we sort of head off, I do have a final question to go around it and everyone and their final thoughts and everything. But one of the things I always ask on any of our events that we do is, what can people watching this do differently tomorrow as a result of what they have learned from today? So it's all, often about practical guidance and everything. My question is, what advice would you give to the leaders and the aspiring leaders of today's radiology services? So Elaine, I'm going to come to you. I'm going to go around the room. Up to you, Rachel, Melanie, Kerry, then Carolyn.
I think get involved at their own level and talk to their leaders and see what they want as the career progresses. As we've heard, a lot of us are accidental leaders. You might never want to be a leader, but you might see somebody else around you that you think has really good potential. So give them a nudge now and again and see how far they can get. And you'll be surprised. That student that I spoke about earlier on, she's now the chief exec of a hospital.
Wow, look at that. And I do wonder, actually, Elaine, if she's maybe the only chief exec who's from a radiographer. So maybe we can get her on one day as well. But, that's amazing. Yeah. But look at that. Wow. Well, maybe you were a role model for her as well, Elaine. So amazing stuff. Thank you for sharing that. Rachel?
I would say don't be afraid to challenge. I think, we're all in positions, even if you're a junior member of staff, a senior member of staff, don't be afraid to challenge and ask those questions. Why are we doing it this way? Don't you think we could do this better? That would be my takeaways. Don't be afraid to challenge and see where it takes you.
there's definitely been that theme come out from today as well, and just thinking about a chief exec who's a radiographer shows the art of the possible as well. So yeah, amazing. And Melanie?
I think just if you are a leader, it's to bring other people on with you. You know, it's about sharing that sort of experience and those opportunities and everything else. And if you are aspiring, I think it's about opening, looking outwards to see what's available. And similarly to what Kerry said, I often say, take your own chair to the table, don't wait for one to become available. Showcase what it is that we can do as radiographers in this space.
Definitely. Totally agree. I think that sort of being able to sort of stand out and amplify the voice, comes from yourself as well. And that's not an easy thing when people attribute that to maybe sort of someone having an ego, but it's not that. You just have to realise the reasons why you're doing it. Because you get to that point in your career when you go, wish I'd done that. Kerry?
I think reach out to people though, because sometimes you think, oh, that leader's a bit scary, or that they're quite high up, or they're just drop them an email. They're probably quite relieved that somebody wants to chat about something that they enjoy.
Exactly. No, I totally agree with you, and that's excuse me. Another point that's come out today is don't be afraid to ask. That the natural curiosity. Kerry, over to you.
Yeah, I think it would definitely be a long theme of be curious and stay curious. Don't let anyone put you off. Find a door to open yourself. And finally, think of the best role model you know, and then aim to be a better one.
Yeah, brilliant advice. Thanks, Kerry. Carolyn?
I would say, I believe everything everybody said is really true, and following on from that, do the thing now. Don't wait for, so in a year or two's time, I'll be better prepared for it. A year from now, you'll be glad you started today. So do it now, just get on with it.
Yeah, there we are. I am so honoured to have been in this virtual room. I hope I've done you justice. I hope everyone has enjoyed the tonight's event. The Cheering the Cheerleaders initiative, and we'll be running one in a month's time with a reporting cohort, because we're very fortunate to get a second group that happen to be reporting radiographers. So we're going to run that in a month's time. But I hope we can sort of press on with momentum from evenings like tonight to really demonstrate what amazing talent we have in the profession. And I can't thank you all enough for being part of this event today. And I hope anyone who's watching this can be curious enough to ask Kerry, Melanie, Rachel, Elaine, and Carolyn questions. I think we it's fair to say now that we know that the door will be open to you. And I hope people will be able to look at whatever it is they do tomorrow and take a different lens on it. So thank you ever so much for everyone for joining. The speakers, if I can keep you back for just 2 more minutes as well, that'd be great. Thank you everyone for joining us, and we hope to see you again soon. Thank you.